Thank you, listeners, for joining us for today's Elko Live radio show. A lot of times on this program, we like to bring in our guest from our local government. We like to talk about arts and entertainment, and we also talk about specific issues that impact the lives and the health of our community and families. And September happens to be Ovarian Cancer Awareness Month. Although after we talk with today's guest, I hope that in your family it will be a conversation that you can have every single month because that's part of the issue in diagnosing ovarian cancers. We need to be able to talk about it. So today we have retired Elko City Manager Curtis Calder, who is also a podcaster in the community, broadcaster with Global One. We sure appreciate, Curtis, your sharing your story alongside Brandy, your beautiful wife, and your journey through ovarian cancer. Brandy, thank you for being on the program today.
Thanks for having us. We're looking forward to the opportunity to share information about a cancer we were unaware of really prior to my diagnosis.
Absolutely, and a lot of people listening to this program. So stick around for this. I know that you probably have discovered, Curtis, on your journey that cancer is a scary word, and either people want to talk about it and share their experience, or some people just kind of shut down, don't they?
Yeah, it's a terribly scary word, and you hope that you never have to deal with it. I think we've all been touched with it. There's been family members or friends and people on your periphery that may have dealt with it, but you always kind of hope, well, that's not going to happen to us, and you are kind of just, through wishful thinking, hoping that you won't have to deal with it directly.
Well, let's start with your story because, again, this journey has been about your family. And Brandy, you guys have a really great love story. If you wouldn't mind sharing how you you guys got together. It's been really fantastic watching your relationship over the years.
Thank you. Curtis and I have known each other for a long time, but we started dating in 2008. And even though we were friends prior to that, we discovered that we were probably more like peanut butter and jelly. We were made for each other, and we've been inseparable since we discovered that. He's my best friend, and we melded our family. We have his, mine, and ours with our children. So we have 4 boys together, and just a beautiful life together. It was last year when I was diagnosed with ovarian cancer. Curtis was preparing for his retirement from the city of Elko, and we were looking forward to what the future had in store for us.
Right, Curtis. And obviously, we shared that adventure with you because you were ramping up to, vacate your position at City Hall, and you're regular on this radio program on Tuesdays talking about city issues. And then suddenly the world lurched under your feet.
Yeah, in addition to the looming retirement, Brandy had received a big promotion at her job. She's the manager of the Social Security office here, and she had gotten a promotion to a district manager job in Sheridan, Wyoming. So it kind of dovetailed together. I was going to be able to retire. We were going to relocate our family to Sheridan, Wyoming, which Wyoming's always kind of been a dream for me. I go to Wyoming a lot, and I always kind of hope to live there someday. Brandy grew up in Wyoming, so it was like going home. And that happened just before the diagnosis. And so when we got the diagnosis, everything changed. We had to completely pivot every personal part of our life to accommodate for what was going to happen over the next year, for sure.
And in the last year, you've learned a lot of things. I think your relationship, if nothing, has strengthened. It's certainly evident. And you want to share this story, Brandy, because you didn't have any obvious symptoms or signs of ovarian cancer. And that's what we want to create here, is more awareness and more conversation so that other people who are impacted, and there will be people impacted in our community, will know what to do and know your story.
I hope so. I was definitely caught off guard when this whole journey began for us. As Curtis was sharing, I had accepted a position. We were preparing to move. We actually had a vacation planned in July of last year. And prior to the vacation, I wasn't feeling well. I kind of had a sore throat. So I went in to see an urgent care provider near our home. And when I went in, she noticed I'd had a cough, and she asked me how long I'd had the cough. And I told her, well, it had been about a month, but I wasn't too concerned about it. And She said, that's not normal to have a cough for that long. It wasn't productive cough. I was exercising regularly, running, riding a bicycle, probably almost feverishly working out at the time, so I wasn't really concerned about it. She ran an x-ray and thought she saw a spot on my chest and ordered a CT scan. I thought she was insane. I didn't think anything was wrong. I felt probably at the top of my health, my energy was good. I had all these things coming up. I didn't want to slow down and deal with scans, especially if I wasn't sick. So I decided to go in and see my primary care provider, Dr. Ronald Simon, early the next week. And he said, Brandy, she's right. Something's wrong. We need to check this out. So I did proceed with the scans. I actually ended up going through 3 different types of CT scans of my chest and abdomen. Probably late July, he called me after my final scan and said, Brandy, I'm going to make a referral to the Huntsman Institute. We noticed a tumor in the scans, and we want to have more testing done on that. And he said, I can't guarantee it until after the testing, but it looks like it might be cancer, so we need to have that. We need to have that looked into. So he made an appointment for us at the Huntsman Institute, and I think blindly, maybe slightly ignorant, even I thought, well, they're going to go in, they're going to see this tumor, they're just going to remove it. There's nothing wrong. I feel fine. I'm at the top of my game. So Curtis and I went in for the testing for the biopsy of my tumor, and almost immediately discovered it was a bigger deal than we had anticipated.
So again, people listening that have received this kind of news, you've been, or you've helped family members or loved ones, you can sense that anxiety. I mean, the huge emotional blow that we're all taking a pause here. We're taking a moment because anybody that's been through this knows what that conversation is like. So at that point, Curtis, a lot of weight shifted onto your shoulders, and you were able to help Brandy and really get into the mode of, making sure she was receiving the treatment that she needed, which this is the positive story that we want to tell. Even though, as you mentioned, ovarian cancer is called a silent killer, there are more tools available now, right, Curtis?
Yeah, so Brandy's ultimate diagnosis was stage 4. Which sounds horrible, and it's not great. But what the medical team told us, we were assigned a medical team, an oncologist, a surgeon. They have a tumor board. They have a lot of resources at Huntsman. And so what they had told us is that ovarian cancer, unfortunately, almost always presents itself at stage 3 or 4. If you were to catch it at stage 1, it would be a lot more curable. Your odds would be far better at stage 1 than stage 2, 3, or 4. But unfortunately, because there's no real good diagnostic tools like there are for breast cancer, almost all people who are diagnosed are getting it at stage 3 or 4. So with that news, the next step was, well, what's the treatment plan? What are we going to do? Because you want that immediately removed. You don't want to wait a month. You don't want to wait 3 weeks. You don't want to have things scheduled. You want to get moving. So they said that will come with time. The treatment's going to involve chemotherapy. It's going to involve surgery. It could involve other things down the road. But that's the immediate plan is that. And we had to kind of straighten out what was going on in our personal life because we were 2 days away from signing all of the paperwork on our house and our relocation with the federal government. And so we stopped that process. We unwound that process simultaneously to trying to get the treatment going. And so there was a lot going on in a short amount of time. Our jobs were super supportive. So all the city employees that I work with are my friends and my coworkers and my colleagues, and they had my back completely. Any time off I needed, they covered me. Brandy's management team, same thing, just total support from our employment. So that was helpful. Total support from our family and friends. That support network's super important because you're going to be traveling a lot. You're going to need to coordinate childcare. Kids still go to school. Life still goes on. So a lot of family help there. So that was all kind of at the front end of what was going on. And to me, it seemed like right after her biopsy happened, her symptoms started. It was like the needle that went into the tumor stirred things up, and within a week, she started getting really sick. So that was concerning, to go from practically perfect health with just a dry cough to this really bad bloating. She was developing all this fluid in her abdomen, and it required us to go over to Salt Lake and have that fluid drained from her abdomen. That was frightening. And right on the heels of that was when her first chemo started, and our oncologist said that as soon as she starts receiving chemo, she's going to start feeling better. The swelling and things are going to go down. And she was absolutely right. As tough as the chemo is on the body, it's even tougher on the cancer. So we saw immediate results, which was heartening. And again, we're dealing with, we don't really know what stage 4 is going to result in, but we know we have to go through the treatment.
And so, Brandy, in 14 months, you've had a lot of procedures, right? I mean, but here you are, you look beautiful, you look actually at peace, and you look very happy, I have to say. This may have changed you, obviously, but...
It did. I found cancer to be, it was a journey, and it was a blessing. There are things that came from the journey that we've been through so far that have brought me to a place where I appreciate my life in different ways, the quality of my existence in different ways. And I feel like right now I'm in a good place. Right now I feel healthy, and I feel like it's my responsibility to share some of this information. It's some of the things that I want to share too. You know, we're talking about how this all started, but I'm sure it's like this for other cancers, but the diagnostic portion, the portion where I was going through the tests and we didn't know what was going on, was infuriating. We knew it was cancer. We didn't know how bad it was. And while we were waiting to find out, my cancer had spread to my breast, throughout my abdomen. It was growing rapidly. And my doctors thought that the growths probably began in March. So between March and when I had my first chemotherapy treatment, which was in August, there was a significant amount of growth. So there's zero screening for ovarian cancer. I mean, I get my tests, I saw my doctors regularly. This isn't something that you find just, from your annual gynecological exam. You really have to be listening to your body. That's how, it really is a silent killer. I didn't have any pain. Curtis was right until they started the testing. So,
and Brandy,
really frightening.
As older women, they tell us that we don't have to see the gynecologist every year now. I mean, isn't that your experience too?
It is. I was told I didn't need to go in for 3 years, although ironically it had only been a year. And in retrospect, I did have some of the, signs, but they were very similar to premenopause, and I marked a lot of it off as premenopause issues. My abdomen was kind of, I lost my little waist. I was tired, but those seem like minor things. And I think all people do this, but especially women, especially mothers, we kind of get used to operating on empty anyway. So it just didn't really alarm me. Mm-hmm. Yeah.
So we're talking about, again, the lack of symptoms with ovarian cancer. There may be some risks associated that maybe you learned along the way. I don't know that this is a cancer that, is considered environmental, or if it is primarily genetic, Brandy?
It can be both. For me, I do have a family history of ovarian cancer. I wasn't aware of that until I was diagnosed.
See, conversations are crucial.
Yeah, and they happened, but not until after I went to the doctor. I have a first cousin on my mother's side that died of she had stage 3 ovarian cancer and she passed away. And I have an aunt who was diagnosed with stage 1 ovarian cancer. I just didn't know it was out. I didn't know it was out there. I actually thought that they had breast cancers and got my mammogram regularly because of them, and you should get your mammograms regularly.
Yep, but I will tell you that too.
Yeah,
Mm-hmm.
Yeah. There are two genes, two gene mutations, the BRCA1 and BRCA2, which were common in breast cancer. And they're also common in ovarian cancer. So women who test positive for BRCA1 or 2 are more prone to have ovarian cancer. Women who have been diagnosed with breast cancer previously are more prone to have ovarian cancer. I went through genetic testing at some point during this process, and there are genes that haven't been identified because there really isn't the type of testing on this type of cancer that exists for other cancers like breast cancer, which is great. I mean, I think breast cancer research is fantastic, and I imagine that growth will happen in these researches for other cancers at some point, but my doctors are certain there's a genetic connection. It's just not named right now. But there are things that can, there are other just miscellaneous factors that can contribute to ovarian cancer susceptibility. If you were a female at birth, you're at risk. If you're overweight or obese, that increases the chances. If you take hormone replacement therapy, or if you have fertility treatments, that can contribute or increase your chances. A family history of ovarian cancer or colorectal cancer. Those BRCA1 and 2 mutations that we talked about, and smoking. Yeah,
Okay.
so those can increase your risk. And things that can decrease risks, and I thought this was interesting, but if you take birth control pills, that can decrease your risk. Childbirth and breastfeeding can decrease your risk. Of course, surgical removal of your ovaries and fallopian tubes or a hysterectomy can decrease your risk as well.
And that's not something that you can just go in and request.
Yeah.
I mean, that's the environment that we live in with insurance and supplemental. It seems as though we have to experience something catastrophic in order. That's not considered preventive health care, right, Brandy? So the emotional aspect of all of this, I wanted to make sure that people understood you did have a great support system. Curtis has talked about that. And you do have a primary care physician, which is an important part of the process too. Curtis and you and I were talking about that before the program.
Yeah, I think I'm grateful to my doctor, to Dr. Simon. I mentioned him previously. I really don't think I would have pursued any of the testing had he not pushed me to it. Let's just be safe. I think you're fine, but let's make sure. And having that relationship with him, and he knew what my concerns were. He knew what was going on in our personal life as well. But he still prioritized and had me prioritize my health over all those other issues. So it was important. It was vital that we
Had
pay
that
attention
support.
to those things. Yeah.
And so, Curtis, obviously the discussion about having a primary care doctor, if you can get one and you can retain that doctor and maintain your health, even though you're healthy, right?
Yeah, so Elko's always been a really tough community to have medical providers here. So I'm sure at a shortage of not just specialty care people, but just of primary care folks. And I know a lot of people probably go to urgent care when they're sick, and those are great too. Those are needed as well. But in a place like Elko, if you can have a relationship, an ongoing long-term relationship with a primary care provider, it makes a big difference because they do know your history. They know what your body's going through. They've seen you for years. They might just have a gut feeling that, hey, something's wrong. And in this case, that was really important because time is of the essence. And the initial plan from Huntsman was they were going to do surgery first, remove the ovaries, the tumors, debulk, do all the things they needed to do, and then chemo was going to come after. But from the time of diagnosis to the time of her swelling happened so quickly, they completely changed the plan and they said, nope, we're going to start with chemo. We're going to give you 3 rounds of chemo to knock this back. Then we're going to do the surgery, and then we're going to give you 3 more rounds of chemo. And when I talk about chemo, everybody's chemo is different depending on the type of cancer you have, and they do all the genetic testing. And in her case, her chemo was 3 different chemotherapy drugs administered over a 7-hour period. So that required us to go over the night before, stay the night, get in first thing in the morning. They do your blood work to make sure you can even have the chemo, because there were times we showed up and our blood wasn't good enough to have the chemo and we had to come back. So we went all the way over, stayed the night, incurred all of those travel expenses only to be rejected and come back. And that's disheartening. because you want to have the chemo, but they're saying, well, your blood's not at a position, your platelets, your white blood cell counts, all of that's off. So they start that really early in the morning. And then if you are given the green light, you're pretty much there all day, hooked up to the IVs until late afternoon. And then you're not going to be feeling real great. And you come home and you get through the next few days and you just take it day by day, because you might come back okay because they fill you full of different types of drugs to make you feel good. But as 2 or 3 days go by, you those wear off and you're not feeling so great.
And you're still living with that insecurity and the anxiety of yes, absolutely.
Yeah.
So at this point, obviously, as we're creating more awareness about ovarian cancer, and we want to remind people that it's important, it's like anything else. We've been having conversations. You mentioned colon cancer in this conversation and breast cancer. We talk about suicide awareness now on the radio. All of these different topics, people just didn't used to discuss in public, Brandy, and I'm not sure if you still encountered that but these are conversations that we need to have. For example, listening to your body. You thought it was perimenopausal, premenopausal, that's the ramp up to menopause, and those are pretty typical symptoms. But should people go to the doctor if, say, they're starting to experience what you experienced?
I think so. I think you have to. Your doctor should be aware of what you're experiencing with your body, whether it's a hormonal adjustment or not. And I'm grateful that I had those resources available to me. A lot of women don't have regular doctors. They can't afford to go in for checkups. But I think that if that's something that's available to you, you need to pursue it. And I would hope that, there are these organizations like the National Ovarian Cancer Coalition that try to raise money to encourage women to go in for treatments and exams. I think it's important, like you said, to talk to your family about your family histories. So, I think this is a conversation that we should be having. I do have a few more statistics I want to share too.
I was going to ask about that, how prevalent ovarian cancer is. Yeah.
1 in 78 women are diagnosed with ovarian cancer every year.
That's a lot.
It's a lot. They call it the silent killer, but if you think 1 in 78 women, how many women live in Elko County? That's a lot. That's a lot of people. That's a lot of people. In 2023, they estimate 19,710 women will be diagnosed in the United States, and 13,270 women will die. I just think it's so important to be aware of what's happening. We're prepared. I would like to think that this isn't going to recur, but we're prepared for a recurrence of this cancer. We're going to treat it like a chronic illness, and we've had those discussions at my home. And I have a great support system. Curtis obviously has felt every bump, every bruise, every needle prick that I've been through over the last year. But I have, these beautiful children. We've had friends, people visiting, people helping. It's so important to have that emotional support in addition to all the medical support and spiritual support as well.
Mm-hmm. Yeah, you find your love throughout the process, right? Mm-hmm. I mean, that's part of it. This is a difficult conversation because it's been so emotional, and because this couple and this family has been through so much, and you're highly public and visible in the community. Again, the love comes from all kinds of different directions, but I'm sure you've noticed too, Brandy, that at least when that happened with me, when I had my breast cancer, and mine was very, very early. I didn't have chemotherapy or radiation. I simply had 2 different surgeries. But people, it's tough. People don't know how sometimes to approach you, or how they want to talk about it. And sometimes they don't know what to say either, right, Brandy? Because here you are on this doorstep.
It's true. I think it's hard to know the right thing to say. And sometimes it's hard to know how to receive the comments. But I think generally people are coming from the right place. And I felt like I was given a platform to talk about what was going on. Mm-hmm. As a side note, I talk to a lot of women with breast cancer, and I feel like we're sisters. We share that experience, and they were so open with me about their experiences. Breast cancer is treated differently, of course, than ovarian cancer, but But we all understand the fear.
Oh, yeah.
You know, and we're bonded by that.
That's an underground river that runs throughout. Absolutely. Because again, whether you're a mother or a wife but you're somebody's sister, you're certainly, you know, a daughter. And again, there are just so many different aspects to these serious illnesses. And I wanted to circle back because Curtis, you are a historian and, you know, I guess I want to say that when something is before you, you really get into it. You research it. And so when we're having these conversations about ovarian cancers detected not until stage 3 or 4, what about stages 1 and 2? I mean, were you able to learn anything about, why aren't we diagnosing these earlier?
Well, I think if you're fortunate enough to get it diagnosed at 1 or 2, it's probably just dumb luck. Based on my conversations with our surgeon who does these all the time, he said almost all of his patients present at stage 3 or 4. And he says
there's something wrong with that.
Yeah, and and a lot of people go, well, gosh, there's this blood test called a CA-125, cancer antigen 125. And the first question I asked, because they started giving that to her, and that's how they measured how much cancer was in her system. Well, why don't they just give you that blood test? And it's not a reliable test. There's other things that can cause those numbers to go up. It is a very good test once you've been diagnosed to track it, but it's not a good test that they would give to just anybody walking in the door. So that's kind of the first obvious question that comes up, I'm sure, from every patient asking, well, why don't we get CA-125 tests when we go to the doctor? And it's not a reliable test. So until there's a better diagnostic tool that can be really standardized across the board, it's going to be one of those situations where you really have to listen to your body. You have to follow your hunches, your gut, because time is of the essence. I mean, things happen so quickly. She went from being perfectly healthy to really, really sick in about 2 weeks. As soon as that biopsy, that needle punctured that tumor, that started spreading like wildfire. And it was really scary because we were anxious to get things going, and they can't really start the treatments until they've done all the genetic testing on the biopsy. They have to take a piece of the tumor, and their research labs or whatever they have at Huntsman are going through there, the pathologists, determining what treatment's going to work on that type of cancer. Because I think they told us there was like 38 different types of ovarian cancer. There's not just one type. There's all these different types.
And so, Brandy, reflecting on all of this, obviously there are things you cannot change, but anything that you would do differently, I guess?
I think so. I know we keep kind of circling back to this, but I think it's so important to go in for regular checkups. I had retrospectively, what do they say? Vision's 2020 when you're looking right back. I had some bloating and some discomfort in my abdomen early in the year. And I thought, well, I should go in and see.
But you think gas
doctor.
Yes.
I did. Mm-hmm. But I wish I would have pursued that. I also think that just wasn't part of the journey for me. That maybe wasn't the plan. That maybe we went through this for a reason, so that we can share our story and help other women be more aware. And it sounds like a tragic way to get there, but you know what? I mean, here I am, and enjoying my health at the moment, enjoying improvement every day, and just, I want women to be aware. I want women to be aware.
Brandy Calder, alongside her husband, Curtis Calder, our guest today, and we've been talking about ovarian cancer. The month of September is the actual awareness month. There's a national proclamation, and there have been walks and groups and talks and different things happening, but this is really a conversation, again, that should be happening regularly. At Thanksgiving, when you have all your family and friends say, hey, by the way, when Grandma passed away, what did she die from? Because the same things happened in my family. Where Brandy, I thought it was something else, and it turned out to be something else. So these are conversations that we can all have to help us better understand our bodies. Curtis, as a man in the room, have you thought more about your own health? Has this taught you, has this been an experience for you?
Yeah, I know when I turn 50, again, I go to the same doctor Brandy does, Dr. Simon, and when I turn 50 and I get my annual checkup, he said, well, it's time for you to have your colonoscopy. You're 50 now, you have to go have that. And I was like, oh, really?
I've had 2 of them.
Like, man, can't I just push that off for a while? I'm in pretty good health. And you're, no, we need to get it done. And so I did reluctantly do it, and I had it done up in Idaho, and it was not a very fun thing to have done, but it came back clear and everything. And I can tell you now that we've been through this with the ovarian cancer, I would never miss one of those, because that's a very treatable disease if you catch it early, and there's a perfect diagnostic tool. So I know people don't like to talk about it. It's kind of gross and all that, and it's not a pleasant experience. But nobody should be missing those, because that is a curable form of cancer.
Well, I don't mind talking about it, and I had mine done at NRH, and Dr. Ward did it, and the nursing, and they were funny. They made me laugh right up until my eyes closed, and then I woke up and said, "It's over?" That took like 30 seconds, and they said, "No, it took longer than that." But yeah, so absolutely. I mean, they're great diagnostic tools, Curtis, and I wish for my daughter now having this conversation, because all I'm thinking about is my daughter, and I was tested, and I do not have the BRCA gene, so that was not a contributor to my, my early onset breast cancer. But I would love to know that going forward, there are tools so that my daughter can be more confident in her life as she ages. Because as women, that's all we want to be told is to be reassured that we're doing the right thing, we're living healthy lives, right?
Yeah, my sons are going to be at increased risk for colorectal cancer. My sister, I have 2 sisters. One's a first-degree sister, a full-blooded sister, and she elected to go in and have her ovaries and fallopian tubes removed. She'd already had a hysterectomy, but had kept her ovaries for hormone purposes, and her doctor agreed that based on what was happening in our family, that was the right move for her and for her continued health. So I'm glad that that's a discussion that we had. And just a little side note, I'd like to share, this is also Prostate Cancer Awareness Month.
Yes, I was going to ask the big P word for you, Curtis. Yes, thank you, Brandy, because that's, again, men can live with prostate cancer for a long period of time. It can be undetected. But again, if it's diagnosed early, it's also treatable. So yeah, thank you for mentioning that. Well, in the conversation that we've had today with our dear friends in the community and, of course, in our personal lives with Brandy and Curtis Calder and their journey through ovarian cancer, I want to make sure we got to all of the topics that you were hoping to. Curtis, is there anything that's kind of weighing on your mind throughout this? Or
Well, just to kind of close out the conversation, I think it's important that when someone in your family or yourself gets a diagnosis of cancer, we're close to Salt Lake, Huntsman Cancer Institute. It is the only national cancer institute in the Intermountain West, which includes Nevada, Utah, Wyoming, Montana. So you've got an excellent facility with an excellent team. So there's reason for hope. And despite our very grim diagnosis, a stage 4 cancer diagnosis, I'm pleased to report about a month and a half ago, 2 months ago, the doctors declared her in remission, no evidence of disease. So it can happen. It's not a death sentence, and there's reason for hope. And I would hope that anybody who gets that type of diagnosis avails themselves to all of the options instead of giving up. There's no reason to give up. You need to fight it.
Thank you, Curtis. In fact, his T-shirt says, "My wife's fight is my fight," and that was a gift from a friend. So, and that gave you a lot of support too.
It did. It's one of my favorite shirts to wear when we're in Salt Lake at the Huntsman Cancer Institute, because when you go there, if you've never been there, we've been there a lot now. Everybody's going through the same thing. There are literally on any given day hundreds of patients walking through that facility in various different stages of health, various different ages, everybody from young children to elderly people, and their families are with them and they're being supported. And Huntsman just as an organization and as a facility, it's really a next level facility. It's the type of medical care you would hope everybody could receive.
I felt that same way with I had my initial diagnosis here in Elko, and I couldn't say more for the care and the professionalism and the technology that was available to me. But then it was time to go on, and my experience was similar at Intermountain Health, Curtis. So yeah, we are so fortunate to have these resources literally in our backyard. Well, Brandy, really, truly, the last word belongs to you, because this is your story, your journey together as a couple, but certainly you as a woman and as a friend. So
I think a lot of people will relate to this, especially people who have been through the cancer journey, but don't forget to take care of the caretakers. Curtis and my sons made sacrifices to help take care of me. He still has to take care of me because the chemotherapy has long-lasting effects. He not only has traveled through all this, but he makes my meals for me at night because I can't always stand up after work, or I can't exercise, and he'll push me when he knows I need to walk, and he makes sure that I get the rest that I need. And I'm sure that that's frustrating. You know, I can come home after an 8-hour shift and say, I have to go to bed now. And he's able to live with that, but it adds extra pressures. And so, you know, if you know somebody going through this cancer journey, of course, you know, we want to pray for them and we want to support them, but their families and their caretakers are just as important, and they're going through it too.
Brandy, thank you. Of course, you would reach out with that kind of love, and that's the kind of family the Calders are. So today's program featuring ovarian cancer awareness, and there are resources online. But again, listen to your body, talk to your family, see your primary care provider, or seek out help immediately. But listen to your gut. That's been said on this program a couple of times. You know your body better than anyone else. So get the care that you need, be aware, and do everything you can to prevent these types of illnesses. Thank you both for being here today. I really appreciate the opportunity to have a conversation with you, Brandy and Curtis.
Thanks, Lori. Thanks for giving us this forum.
Yeah, thank you so much.